Hi everyone, welcome to Nurse You Like. This is me, Nurse Ray. So let's talk about health assessment. So we're gonna talk about some overview first of the form. So usually you're gonna have like a 4 pages. This is page one, this is page two, then followed by the next page that will be page three and page four. But don't worry, you will only receive a 2 page form for this because it's back to back. We're gonna just tackle it one by one. Okay, for now we're gonna be focusing on page 1-1. So we're gonna talk about the nursing assessment form, and this is what you call the demographic data. So for the demographic data, we have here the name of the client, of course, the name of the client. So you should start first with a last name, not the first name. For example, John Smith. Now, when you say John Smith, the first name is John, the last name will be Smith. So here you write here Smith, then comma John. Okay? There you go. Then you put the age and the sex, whether it's a male or a female. That's it. So if it's a male, you can just put there M. For civil status, it can be single, married, or widowed. Choose only one. Okay? So next will be medical diagnosis. So for example, if you look at the chart and you already see a doctor's diagnosis, or you can ask the patient if there's a diagnosis from their doctor about this one. So for example, diabetes, okay, diabetes type 2. Okay, the examiner will be the student. That's gonna be you because you're the one gonna be using the form. Okay. Right. Now, let's move on to the next. So, part of the demographic is the religion. So, you can put here what is a religion, Christian, Muslim, or Roman Catholic. But remember, never put RC or make things a little bit short. So, you really have to complete the word Roman Catholic. Okay? Do not abbreviate. Now, for the information given by, then usually this is going to be the patient, which is the primary. We talk about secondary again, that's the wife or the son who's giving you the information. That's the secondary. But here we usually place here patient. Okay? Then we're going to put the date of admission. So we'll just put here some sample. Then the bed and the unit ward. So if this is private, the bed can be also considered as a room. So, for example, if it's a private room, then if it's room 102, then you can just put here 102. But in a ward setting, there are different types of ward. There is a pedio ward, there is this male ward, and there's this female ward. Okay? Now, so if you say female ward, we're dealing with lots of bed. There are like 5 beds there in a ward, or 6, we don't know, or 10, could be worse. So we can indicate here male ward or female ward if they are all male, but if it's female, they're all female. So what particular bed in that particular male ward are they assigned? So example is bed number 5, so put there number 5. Okay, so next will be the vital signs na tayo. Okay, vital signs na tayo. So I know you're familiar with this one, so we will start with the temperature. Now remember, you start first with the axilla, followed by the oral. Pag di pa gyapon makuha, then the last will be the rectal. But you always start with the axilla. So let's put here, assuming that we already assessed already, 36.5 degrees Celsius already. So that's a normal. For the pulse, so pulse, assuming that we get only 95. So that, how do we read this one? Is 95 beats per minute. And for the blood pressure, depending if when you took the blood pressure, are you letting the patient do the standing position, sitting position, or lying position? So I'm sure that you put the patient on a sitting position, so just put a check mark there. And then of course, the BP here is 120/80 millimeter of mercury. And of course, we have the respiratory rate, assuming that we got it at 20 breaths per minute. So is this a regular or irregular? So it's up to you. So I'm gonna put a check mark on that one. Okay, next will be the height. Remember, we're gonna use centimeter, not inches. And for the weight, we need to convert that to kilogram. So for example, if the patient is 120 pounds, Then we need to divide that to 2.2. So if you put 120 divided by 2.2, it will give you 54.54. So that, if you're gonna round it up, that's gonna be 55 kilogram. So you put there 55 kilogram. Oxygen saturation, well, we're gonna give here at 95%. And for the heart rate, example is gonna be like 110 beats per minute. There you go. So that's it for part 1. Thank you so much for listening and watching the video. I really hope that this would help you and better understanding on the forms. This is me, Nurse Ray, on Nurse You Like.